More and more now, we are seeing a lot of the non-invasive, non-surgical things.
That's what I'm.
Some
For
people,
permanent, is it permanent usually?
I mean, here's the thing with a lot of those things. It's the old saying, you get what you pay for. Like typically less recovery, less invasiveness is less of a result. But on the other hand, there's value to that. You don't want to undergo the knife. But the other thing is, I think with plastic surgery, we're getting less and less invasive too. So we are able to do a lot of things under local anesthesia, a lot of things that are shorter scars and things like that. So
What are you doing for back here on women, like right here?
Well, it all comes down to what the issue is, right? If it's fat, you can do liposuction. I'll tell you, this is a chronically challenging area for me. And I'll tell you why. It's because the skin is inherently thick in that area, number one. And number two, you gotta have some looseness of your back. Otherwise, how are you gonna lift up your arm? I mean, imagine your jacket is just way too tight, and that's very confining, right? You gotta have some, so it's a challenging area, and I always tell patients that, like, listen, you gotta be able to lift up your arm. Otherwise, it's tethered down. You gotta have some laxity there. And the skin is thick, so you can thin it out, but you never really completely 100% get rid of it. Anesthesia is actually very safe. I did an anesthesia case, liposuction in a Brazilian butt lift this morning. Saddlebags, flanks.
Are you doing them here?
Yeah, we have 2 certified operating rooms on site. We have the same certification as the hospitals. It's called JCO certification, or Joint Commission.
I'm a DO.
Oh, so we have JCO certification. We have actually a surgery center. We're not just like
That's what I was just going to ask.
Yeah, we're not a quad HC or quad SF. We're a JCO. Bye. Take care. Yeah.
Thank you for the information. Yeah. I'm going to run up and check it
Please
out.
do.
I'm
Please
sure
do.
I'll be back.
Yes. Yeah. These are the 3 most common areas. So here, here, and here. Botox is your friend. That's the way to go because it softens wrinkles. In fact, it's not even, if you ask me to do surgery on the areas to fix those, I can't, there's nothing to do that.
Right.
So Botox is the way to go, very safe. Now you're what, how far out from your wedding?
August 11th.
Oh, perfect time. You should do it
Okay. Yeah, we should be getting started.
6 weeks out from there, 6 or 8 weeks out from there.